over. Across Syria, 16 million Syrians still need humanitarian support. While, as you heard, the ceasefire in Asweda has largely held, sporadic clashes continue. Alarming reports of abuses during the earlier fighting continue to emerge. More than 185,000 people have been displaced across Asweda, Dara, rural Damascus, and beyond. This week, our teams have visited Asweda city, Salkad towns, and the western countryside of the governorate. They delivered aid and assessed needs. The overall situation is, I'm afraid, dire. We need to sustain urgent delivery of food, health, shelter, clean water, fuel, restoration of water and electricity infrastructure, education. In some areas, those arriving now outnumber the existing population. Services are overwhelmed. We're in close contact with the Syrian authorities and coordinating with the Syrian Arab Red Crescent, who have delivered 12 convoys of essential aid, and NGO partners. We have provided emergency food packages, flour, essential household items to tens of thousands of people, including displaced families. Medical kits are reaching key hospitals in Asweda and Dara, while medical teams are providing health and nutrition services. And UNICEF is working with partners to provide bottled water, water trucking, and fuel for water pumping. The Syrian Arab Red Crescent has also facilitated a commercial convoy with key supplies and worked with the Syrian civil defense to transport vulnerable people, including those who wish to return to Asweda. But insecurity and road closures have disrupted commercial supply. Road access is still limited to 2 routes in, through Basra al-Sham and Bursa al-Kharir in Dara. Other routes, including the main highway from Damascus, remain closed. So, we need better humanitarian and commercial access, and most of all, we need safety. Aid convoys have come under fire this month. There have been attacks on health facilities, medics, ambulances. We continue working closely with the Syrian authorities and partners to strengthen channels for help. And I insist again, as I know that you will, on the protection and freedom of movement of civilians, humanitarian workers, and medical missions. Mr. President, my second point. Despite funding and security challenges, the UN and partners are delivering as much life-saving support as we can with the resources we have. In Syria, as elsewhere, as we implement the humanitarian reset, we are now implementing a hyper-prioritized plan, and we've restructured and streamlined our humanitarian coordination effort in country, including reducing senior roles. We are reaching almost 3.5 million people on average every month across Syria, from Latakia to Aleppo to Hasakeh. That is a noticeable increase from last year, despite less funding. Since December last year, we've scaled up across the humanitarian response. Nutrition for children under 5 who are stunted, subsidized bread to 2 million people every day. We're working with the authorities to rebuild critical services. The Ministry of Health with WHO and UNICEF are delivering a new national immunization strategy and rehabilitating hospitals and health facilities. Partners are rebuilding water stations, wells, laboratories, sewer networks. They continue to provide essential services in Al-Hol camp and to support families leaving the camp. And UNHCR has been in discussions on assuming camp management activities. OCHA's country-based pool funds are now providing $75 million to support vulnerable people across the country. We've made some progress on NGO registration and visas for aid workers, but more is needed. I have agreed with the interim authorities the extension of cross-border operations from Turkey as we move towards importing more humanitarian supplies commercially. The Lebanese and Jordanian crossings are open and functioning well, with work towards 24-hour access. But, and this is of course my third point, without more funding, we won't be able to sustain these vital efforts, let alone expand them to more people who need them. The humanitarian appeal for 2025 is only 14% funded. Aid cuts are projected to lead to staffing cuts of at least 40%, across the humanitarian community in Syria.